with my mom. She decided to come and hear my second presentation, even though she was not here for my first presentation. So my mom, maybe Robona, okay, she is here with us. Okay, so this is actually my student's presentation. And so she had a medical emergency. I worked with her on the research and she was supposed to present it, but she had a medical emergency and I told her not to worry about it, that I was gonna go ahead and talk about her research. So this is gonna be shorter than my normal presentation. You all know when I present, I like to talk. So since this is not my presentation, I'm gonna be very, very on point and probably not use up all the 20 minutes that is allotted. So this presentation is on artificial intelligence in breast cancer research, and it's supposed to be a meta paper, and is looking at paving the way towards a cure. And so one of the things that we all are cognizant of is the fact that breast cancer is a leading cause of death, medical death for women, And so 30% of all new female cancer cases are attributed to breast cancer. Over 310,000 are invasive breast cancer. And so when we are talking about invasive breast cancer, we're talking about breast cancer that has the propensity to spread to other organs of the body. And 1 in 8 women will be diagnosed with breast cancer in their lifetime. And so one of the things that we look at when we are talking about breast cancer is the fact that some of the detection methods do not allow for catching the disease at the very early stages when it's still possible for the mortality rate to be very low. Okay, so normally we utilize mammography. I mean, all the women here know they go for their yearly mammograms. And so when we are talking about mammography, one of the things about mammography is that you tend to have incidences of false negative. And so when we are talking about false negative, we're talking about the fact that it detects or suspects cancer when actually the woman does not have cancer. And so, when people talk about that, they're like, la la, that's not such a bad thing. But when it's a false positive and the woman has to go through the trauma of going for further tests and all that, in some instances she might be less inclined after all that to trust mammography. And then we also have false negative, and this is when the mammography shows that the woman does not have cancer, but in actuality, the woman has cancer. And so basically what it means is that the mammography missed the cancer in the woman. And so when we talk about mammogram and profound AI mammography, okay, it's inherent in that. And some doctors actually recommend ultrasound guided mammography or MRI, in checking out the woman's breast. But there is a solution that is called profound AI, and it's coupled with the regular mammography. And what happens is that when you use the AI, it can help with detection. One of the things when we were doing the research, we looked at some of the AI detection processes, and what you find is that you can have a woman go for mammography today, and AI, and when we talk about AI, we're talking about artificial intelligence. And so what artificial intelligence does is that it looks through hundreds of thousands of mammograms over the years. Okay, so it can detect patterns that show an inclination of the breast tissue to segue into cancer. So mind you, it can tell when you don't have breast cancer, but it can tell that there are indications of the tissue to go into breast cancer. It's like when women usually go for pap smear and they have the HPV and they have abnormal cells. okay, you can go ahead and cut out, the cells from the cervix before it has developed to cancer. Okay, just because you see the abnormal cells. So that what Profound AI does is, because in its database it has seen hundreds of thousands of women's breast tissues over the years, and they follow them to see the ones that eventually develop into cancer. So when you have analyzed hundreds of thousands, you begin to see the changes in the breast tissue that indicate that it's going to eventually segue into cancer. So at the point that you find that the woman is 2, 3, 4, 5 years in the future to having cancer. Am I making sense? Mm-hmm. So basically it's detected, just the changes, it hasn't led to cancer, but in 2 years, 3 years, 4 years, 5 years, the woman will get cancer. So if you see at that point, it's very easy to control the cancer, because regular mammography, when it sees it, there's already a tumor, and if it's a tumor and it's very invasive, it has started, going to the lymph nodes and all that. So that is, one of the benefits of having AI in cancer detection. And so the research is looking at ways of improving early detection. And one of the things about AI is that the accuracy of diagnosing and predicting future cancer is very high, more than that of a regular radiologist, because I'm sure you all are cognizant of the fact that when you go for your mammography, they send it to the radiologist, and then the radiologist will look it over and determine whether it's negative or positive. So it's a human that usually does that. And then we're also talking about AI with regards to personalized treatment plans. And so with that, it tailors care based on patient-specific data. So AI, because AI gets a lot of information from different patients over the years, it can analyze it and analyze the specific kind of tumor, the receptor that it will bind to, and that determines the treatment that the patient will get. Because there's various variations of breast cancer, and so it is important to decide the kind of treatment that the woman will receive. And also, when you have AI with regards to early detection, it can also determine what type of cancer the woman is going to get in the future. And so that will determine if it's going to be very invasive, then you might have prophylactic breast removal. If it's not going to be very invasive, you can consider, lumpectomy or what have you. So it helps with treatment that is targeted to the individual in question. And then it also helps with the development of new drugs. I'm sure you all have heard about Ozempic, Wegovy, okay? So Ozempic, we can talk about the plant that the active ingredient is developed from, because like back in Africa, we actually take the plant, we say we use it as tea, we say it's good, I can't remember the last name, we use it as tea, and it's supposed to help you with weight loss, okay, and it's supposed to help you, it actually controls your blood pressure, it helps control, the tea, it's good hue tea, and then we have the moringa in Africa that we drink. I don't know whether you all have heard about it. Okay, so, but in America, the pharmaceutical companies develop it under the brand name Wegovy or Ozempic, and then it's distilled. And so Ozempic was initially designed for people with type 2 diabetes, okay? But I'm sure you all know it has now been, I shouldn't say repurposed, it's now been indicated for treatment in obese people to reduce weight, okay? And so inherent in that is that when AI is looking through the data, they see the unintended consequences of treatment with Ozempic. And you do that with research. When I was working in cancer research at Vanderbilt, sometimes you're treating somebody for something and you see an unintended consequence. If it's positive, then you might want to explore it to see what it can do. So AI, with research and data, has seen that Ozempic, which was supposed to be for diabetes, because Ozempic actually blocks the pancreas from producing glucagon, when it produces glucagon, then that means that the liver will release glucose into the body. So when it hampers the pancreas from producing glucagon, then there's not going to be any insulin, and you're not going to have that insulin surge. And so they have noticed that it helps with weight loss. And so now and doctors are prescribing it for weight loss. And that is the same thing with AI helping the discovery process, because there are some medications based on AI data research that shows that there are some sort of products or elements, or like I was saying, even the goat UT, it has been found that it lowers the mortality rate in some cancers. Okay, and so it is important to understand how AI can help with the discovery of new drugs, because right now we have set medications that we are using for cancer, breast cancer treatment. Okay, and with AI there is a possibility of exploring new drugs or drugs that are used for other treatment of breast cancer. And on enhanced outcomes, AI aims to improve diagnosis and treatment success. And that ties in with what I had said earlier, because AI has the ability to see hundreds of thousands of data over a period of years, which a human being cannot reasonably get through in a reasonable amount of time. It can make suggestions, and it can flag some highlights that can be studied in the treatment of breast cancer. And so the study looked at, like I said, it was a meta-analysis. So I have my student, she was looking at articles from 2018 to 2023, because when you're talking about innovative research and innovative treatment, you have to look at latest data. You can go ahead and look at data from 2010. It's going to be dated as far as emerging treatment protocols are concerned. So she analyzed data from organizations like the American Cancer Society and Breast Cancer Research Foundation, and she is supposed to do the systemic review of research on AI's impact on breast cancer detection and treatment, to find out the headways that AI is making with regards to detection and treatment. So like I mentioned earlier, it reduces false positives and negatives, and it helps pathologists identify cancer types. Because when you take a biopsy, when I was at Vanderbilt, we used to do biopsy of, I used to work on melanoma research, which is skin cancer. And so you do biopsy. And from the biopsy, you figure out what kind of skin cancer the patient has. And it's a human endeavor. So, I'll do the staining and I'll look at it to decide. And, there is a possibility of error, because we're talking about human beings. Okay, but with AI, it is more accurate. There is a higher level of confidence in its accuracy. So if you say, this is metastatic cancer, then of course it tends to be more accurate. And as I mentioned before, you have personalized treatment, and you can see accuracy comparison. So AI is more than 85%, and radiologists is around 83%, and then when you combine, it's over 90%. So that is very, very good. So you have the radiologists using AI, and I was just talking to my student about AI when we had that round table, and he was mentioning the fact that AI is going to make individuals obsolete. And I said, at this moment, it is a good thing when you combine individuals with AI to get a better result. And that is what happens with comparison of detection methods with just using AI and radiologists, and then combining both of them. So the radiologists will take into consideration what the AI has suggested. Okay. And then one of the things that we are seeing from the research, especially in recent years, is the fact that AI is transforming breast cancer research. But one of the things that I have to say is that when we talk about AI, it's not all the medical centers that have the capability of this. Places like I used to work in research at Vanderbilt. Vanderbilt is at the forefront, the Sarah Cannon Cancer Center. They are the forefront of using AI, and some of the other cancer centers in America. So if you go to your traditional hospital, like the hospital, what's the name of the hospital in Clarksville? Marlena, do you know?
Nova.
Nova?
Nova.
Okay, okay. So if you go to something like that and you're going through treatment there, you're not gonna have AI. So it has not been uniformly dispersed across America. You can find it in specific centers. And so that is one of the things that we have to consider when we're talking about AI. But it can lead, if it is more easily available to all the health centers and all the hospitals in America, it can uniformly lead to better patient outcome. And so there is the need for continued research and data and AI-assisted treatment for breast cancer patients. Any questions? Yes?
Are you able to identify the hospitals that are presently using AI?
Yes, I was supervising the research, so when she was working on the research, you look at hospitals like Vanderbilt, okay, you look at the Mayo Clinic,
Yes.
okay, and then what's the name of that hospital?
Cleveland Clinic, maybe.
The Cleveland Clinic, and then there is one in Texas, in Houston.
MD Anderson.
MD, sorry. So I wanted to say MD Anderson. So we had a list that we looked at because what we wanted to do, because when we talk about AI is recent, okay? I mean, AI is recent when we're talking about fully AI integrative medicine. It's a recent phenomenon. So, when we talk about hospitals, we looked at the list of the hospitals that do that. And so as part of our research, she's gonna go back and look at, their protocol and the patients they've seen, the success rates and all that. And so the indication is that with continued improvement in AI and with continued integration of AI and the practice of medicine, you'll have better outcomes, especially for breast cancer and especially for screening purposes, because with regards to cancer, all cancers, it is best if you can get it at the very early stage when it's still enucleated in that area. And then once you just take it out from that area, it's gone. But the problem is like by the time you see it has spread out to the lymph nodes and all that, and that is where the problem comes in. So if we can integrate AI into the process such that, when somebody goes for their screening, they can tell, ooh la la, there's a possibility that in a year or 2 or 3 or 4 years, they might have cancer. Then they'll be more inclined to have prophylactic mastectomy or something like that. Okay?
Well, I just want to say a couple of words about the buzz term AI. All these things are not new. Trend analysis and predictive analysis used to be done in medical environment, even before. Of course, we gave it a name, the buzzword AI, but the thing that we have to remember is big data is at the center of all this. The programming that is written with big data tend to help all these processes to predict what will happen, as you said, with the cancer. Now we tend to go with the term artificial intelligence. But it's been done in the past as well.
And that's the thing, it was there, you have the data on all that, but the focus now, okay, because like when you go to your physicians or to your doctors and stuff like that, it is important for them to say, okay, we are gonna look at research and combine it with our diagnosis, okay? And that is where the profilation or the acceptance of AI into modern research or modern day-to-day life is interesting. So like when we were doing the research, I had the research where I was looking at women with unusual pap smear. And so you talk to gynecologists, they follow the protocol, you know, the American Society of Gynecologists and Obstetrics, okay? The protocol where they say, like your pap smear, if you have positive, if you have negative for a few years, then you do it every 3 years. Okay, that's the norm. Now, if there is more of an inclination or focus on AI, and AI says, ooh la la, you know, it is better to check the woman every 2 years or 3 years. And the same thing with colonoscopy for people that are 50 years old. I think the indication now based on AI data is to go ahead and go earlier. So, I mean, it's been there. The question is, has it been integrated into the practice of medicine? Okay, when I was at Vanderbilt, I used to advocate for the holistic medicine, integration of holistic medicine into practice of medicine. And I remember they used to think I was cuckoo, okay? Like, you know, using acupuncture for pain treatment, okay, using, you know, stuff like moringa or the tea I was talking about that we have in Africa for, you know, prevention of diabetes and stuff like that. So they used to think I was cuckoo, but now Vanderbilt has a Center for Integrative Medicine. So that does not mean that all those supplements were not there. Actually, when you talk about Ozempic and the product from the goat hue tea, they were using it in the 1600s, okay? So it was distilled, I think it was 1940 or 1957 that, you know, they started looking at products for it. Like something like metformin is also from a plant. And it was also distilled for treatment of diabetes. I believe it was in the late 40s or the mid 50s. Okay, so they've all been there. The question is whether as a practice we can say, ooh la la, we can look at this and look at the benefits and use it for a regular day-to-day treatment. And that is the case with AI. It has been there, but the issue is, have you been able to integrate it generally into the practice of medical doctors?
Yeah.
Okay,
Just
go
real
ahead.
quick.
Okay.
In my family, my sister had breast cancer, but there's no history of breast cancer in her family. And from just a belief, she worked with FEMA, and I believe it came from environmental. Do you think it's environmental if you don't have it in your family?
I think I'm an epidemiologist by training. I went to school in West Africa, and I went to the School of Medicine, and I specialized in parasitology and entomology prior, and I worked with World Health Organization in outbreak research before coming to America, working at Vanderbilt, then going back to school and earning degrees in healthcare, administration and law, and public management and justice. And so when you look at environmental toxins, there are so many things that can cause disease. For instance, my oldest son, Wachi, when he was 2 years old, they diagnosed him with eczema and asthma. So they wanted to put him on steroids. And I said to his pediatrician, don't worry, I'm gonna use my holistic method from Africa to treat him. So I'll use like shea butter and all that. You guys know what eczema is, you know, you break out. So usually you apply topical steroids. And you know, a 2-year-old, it hampers the development and all that. And you can also have steroid withdrawal where you stop, I mean, it's horrible. I mean, your skin will break out when you withdraw from steroids. So imagine putting a 2-year-old. So I said, I will design my therapy for my son. So I treated my son till he got to university. He never had to use the inhaler, you know, for asthma. He never used it once till he went to university. And, you know, he didn't follow the protocol. So now he uses the inhaler for asthma. So when you talk about environmental toxins, like I'm sure, I don't know whether you all have heard about the research of microplastics in the water, okay? Microplastics are in our water. Microplastics can lead to pituitary imbalances, cancer, you know, sterilization in men, and all that. And so it's like I usually tell my mom, you know, like bottled water we drink, okay? So my mom has a propensity to put bottled water in the car in the hot sun. So what happens is that the sun sort of melts it and it leaches into the water. So I tell my mom, I say, please do not put bottled water in the car. And then she tells me, what about when they're transporting it? I say, I don't drink bottled water. I have my own sterilization system at home that I drink from. It's only when I travel, and of course, you can't do anything, you drink it. So when you have stuff like microplastics that were not there before, and as an epidemiologist, when you look at disease progression, I had a friend, she's also a doctor, I went to school with her in Nigeria, she had a brain tumor. And when it was treated, and she's still a doctor, and they found the oncologist say that it was due to that there was a possibility it was due to the proliferation of plastic in her diet. So she will microwave something. You know this plastic plates? She will use it to microwave. And I've always been one to say, don't use plastic use glass for microwaving. So today, I used to tell her that. She used to work for CDC. I used to tell her that she thought I was cuckoo. I'm like, I'm an epidemiologist. You look at data, and you're like, okay, yeah, what are their habits? And then you extrapolate from people's habits into changes in lifestyle. So I used to tell her that. She thought I was cuckoo. Now, she's more straight than I am. Okay, you go to a house, you're not gonna find any plastic. She's not gonna let you go. So she's worse than I am. In my house, I have plastic, but I use it for like if I'm serving cakes or to go or whatever. Okay, so those are the things that you look at from an epidemiological standpoint. And so, you know, like he was talking about with AI, as a doctor, if you have a doctor that you're working with, they can look at the research and work in conjunction with you to find out what is going on, or the cause of the tumor progression. And so it's a lot of work. People have to be aware of that, and of course you have air pollution.
Everyone has to classes. Everyone has to classes.
Everyone, like,
in the infancy.
Well, that's the thing.
Sucking bottles.
That's the thing. Like when I went to Kenya, Kenya has banned single-use plastic. So you go shopping, you know, like how in America
We gotta let her go, guys. We gotta be on time.
Okay, I'll say this real quick. So you use single-use plastic, they're banned it. So you go shopping, they have this thing that actually degrades. I have one that came back from Kenya, my shopping bag, and I had it on my counter. And then the last time I touched it, the thing was degrading. Okay, yeah. So I mean, and that is Kenya. And so when you epidemiologically look at incidences of cancer, you know, historically, like in African countries, they don't have incidences of cancer. They do tend to have infectious diseases. That's a problem. Okay, and so we can look at the lifestyle and the circumstances that lead to that. Well, I hope that answers your question without going too much, because she will call me. Okay, thank you all so much.
We know how long you can talk, honey.
I know.